2010 OneMedForum, I'm now joined by Harvey Homan, the CEO of Urovalve. Harvey, thank you very much for joining me.
Thank you, Bill.
Will you please just give us a brief overview of Urovalve?
Sure. Urovalve is an early-stage medical device company. Our mission is to develop superior products that address problems with urinary flow and control. Our current focus is on a device that one of America's leading urologists has said can be the most significant advance in urinary catheters in the last 70 years. That device is the Serenate Bladder Management System.
Okay. Well, let's talk about the Serenate Bladder Management System. What is it, how does it work, and what are the advantages it presents over typical surgery, medication, and catheters?
Surely. So the Serenate Bladder Management System is designed for men who suffer urinary retention, either due to acute problems such as benign prostate hyperplasia or chronic problems such as spinal cord injury, multiple sclerosis, late-stage diabetes. Currently, those men, if they need a device, have to rely on either a Foley catheter or an intermittent catheter. These are really old devices. The Foley was introduced in the 40s. It requires that a person be tethered to an external leg bag, constantly draining the bladder, really negative impact on quality of life. Intermittent catheter needs to be inserted each time a person wants to empty their bladder. So again, a really difficult situation to live with, and both of these devices are associated with significantly high incidences of urinary tract infections.
So how does your system differ and take care of the problems that are with the catheters?
The Serenate Bladder Management System is a complete system that is an intraurethral valve catheter that healthcare professional receives on an inserter. It's designed to be as simple to insert as a Foley catheter. After insertion, it's designed to stay in place for up to 30 days. The inserter is simply removed, leaving the catheter behind. And while the catheter is in place, it has a magnetically controlled valve that's passively closed, which is entirely inside the urethra. That allows the bladder to fill as it normally should. And when the person decides they want to empty the bladder, they bring an external actuator magnet nearby to open the valve, allow the bladder to fill, take the magnet away, and again the bladder empties. So there are no external tubes, bags that are required. The person doesn't need to do anything every time they're going to empty a bladder other than bring this external magnet nearby. So we refer to the major benefits in three ways. Freedom from any external bags, external tubes, function, the bladder fills normally, and control. The patient has control over when they empty the bladder. And the additional benefit, as I said, we expect to demonstrate is a significant reduction in urinary tract infections, which is an extremely important problem right now associated with catheters. Very high cost, over $3.5 billion to healthcare system that CMS will no longer reimburse institutions for because it's a nosocomial infection.
Which I believe is the leading cause of infection in the hospital setting.
That's absolutely right.
Well, let's talk about patent protection for this technology.
Sure. We have patents issued in the United States and internationally on the valve system, which is the core technology. We have patent pending on the inserter system and the design of the current catheter, which is our beta system. So we have good patent coverage around the Serenate Bladder Management System. We also have another exciting technology in the works that we've just had patents applied for, which is an inserter facilitation system for difficult Foley insertions that we also believe be a very valuable add-on to our company portfolio.
I guess just as a recap, from an investor standpoint, what kind of major catalysts and milestones do you think we can see from Urovalve in the remainder of 2010?
Sure. So one of the most significant things with Urovalve right now is that we're in negotiations with a major medical device company on a strategic partnership that will be an R&D agreement that will really ensure that we'll have the resources and the expertise behind us to ensure that the Serenate Bladder Management System successfully comes through the clinical program and through the regulatory process in the U.S. and internationally. We expect to apply for a CE mark by the end of this year, and we are currently working on an IDE submission with FDA to allow us to start first the initial clinical trial that will support the CE mark, and then the pivotal trial in the United States. So we expect to be able to go to market in Europe by the end of this year United States by the middle of 2012, and then we'll continue development on successive technologies. We feel that the strategic partnership gives us a major advantage and investors a major advantage in that it really is going to reduce the chance of a zero outcome for investors and give us the opportunity for a significant return and have significant upside in the portions of the market that are not covered by the license, as well as in the new technology that we're going to develop. So we're really excited about that. We're excited about the clinical program and look forward to having this device in the market this year.
Harvey, thank you very much for joining us.
Thank you, Bill.
Again, that was Urovalve. For more information, you can visit them online at urovalve.com, as well as information can be found at OneMedPlace.com.